Erythropoietin is a peptide hormone secreted by the kidneys in response to tissue oxygenation or hypoxia. Hypoxia, or loss of blood, results in increased hemoglobin synthesis and the release of erythrocytes. Erythropoietin basically mediates these changes and stimulates the differentiation of erythrocytes from bone marrow stem cells. It binds to receptors on erythroid cell precursors in the bone marrow and increases the transcription of enzymes involved in heme synthesis. Erythropoietin is used in the management of anemia associated with chronic renal failure, chronic disease, and non-myeloid malignancies. All these conditions can be treated with supplements of erythropoietin. Once treatment commences, it takes about 2 weeks for a rise in hemoglobin levels to manifest. Like many hormones manufactured for clinical use today, human erythropoietin is a product of recombinant technology. The human gene for erythropoietin has been inserted into a Chinese hamster ovary cell, and a cell line developed from this. The peptide is then extracted from the cell culture for clinical use. Recombinant human erythropoietin is available as epoetin alpha and epoetin beta, the two forms being clinically indistinguishable. We also have epoetin lambda. Then we also have darbepoetin alpha, which is a glycosylated derivative of epoetin alpha, and because it has a longer half-life, it can be given less frequently than epoetin alpha. As erythropoietins are peptide hormone, it cannot be administered orally. These recombinant erythropoietins are given by intravenous or subcutaneous injection to correct anemia in chronic renal failure disease. Such anemia is caused largely by a deficiency of the hormone. Darbepoetin alpha and epoetin lambda are only available in Australia. So this brings us to the end of this lecture. Keep this image in your mind whenever you are thinking about anti-anemic drugs. It will help you a lot. Stay tuned on sqadia.com for more pharmacology videos.